Good evening, everybody, and welcome to the College of Lake County Board of Trustees meeting. May I have a roll call, please?
Mr. Anderson.
Here.
Dr. Kerrigan.
Here.
Ms. Goshgarian. Here. Dr. Griffin.
Here.
Ms. Howland. Here. Mrs. Olshire. Ms. Paul.
Here.
And Ms. T-Day. Here.
I have a motion to approve the agenda, please.
So moved.
Second,
Second.
roll call.
Ms. T-Day. Aye. Dr. Griffin.
Aye.
Ms. Howland.
Aye.
Ms. Paul. Aye. Mr. Anderson.
Aye.
Dr. Kerrigan.
Aye.
Ms. Goshgarian.
I'd like a motion to approve the minutes, both the regular meeting of January 27th and the closed meeting of January 27th.
So moved.
Second,
Second.
roll call.
Ms. T-Day. Aye. Dr. Griffin. Ms. Howland.
Aye.
Ms. Paul. Aye. Mr. Anderson.
Aye.
Dr. Kerrigan.
Aye.
Ms. Goshgarian.
Agenda item 3, receipt of notices, communications, hearings, and petitions. This is the part of the meeting where anyone in the public would like to address the board. You may do so. Just please stand up and approach the podium. Seeing no one, I will move on to the thank yous. The board received a thank you from Woodlawn Intermediate 4th graders. Apparently they had a wonderful time on a field trip that they had here at the College of Lake County, and they were impressed with what the college had to offer their students. Let's hope they remember that as they get into high school and they're ready to come here. Agenda item 4, the chairman's report. As we said last month, the 2015 ACCT National Legislative Summit was held in Washington, D.C., February 9th through 12th. And trustees Anderson, Kerrigan, Griffin, Olschlager, student trustee T.A., President Weber, and I all attended. I will give everyone else an opportunity to tell you what they got out of the meetings we had, but I thought we had extremely productive meetings with Congressman Randy Hultgren, who only has a small portion of our district, but Congressman Dole was very, very enthusiastic about College of Lake County and actually said to us while we were there that College of Lake County is a treasure in Lake County and we need to do what we can to promote it and keep it moving forward. So we're going to hold him to that. We also had an excellent meeting with Senators Durbin and Kirk, and we were impressed with the thoughts that Senator Durbin has regarding a lot of what's going on in terms of community colleges and especially the not-for-profits. He's still working actively to reduce the amount of not-for-profit impact that it has on the student funding. In addition to meeting with the legislators, we heard from William Crystal, who many of you may know is a TV commentator, Dr. Joe Biden, Senator Al Franken. His speech was absolutely wonderful. He received an award and was definitely worth listening to. When we met with the legislators, we asked for support in not cutting anything we already have. We didn't go in there begging for more. We said, please don't take away what we have. We want to maintain the Pell Grant funding at the current $5,775 level and not limit eligibility. We want to maintain the Carl Perkins funding at the current level. The only thing that we did ask was that they look at ways to do a better job with the veterans programs and to come up with some more dollars or more support for the veterans. We talked about our concern as CLC regarding the federal college rating system, and we reiterated again that we do not want them to judge us like four-year schools, that completion of a degree is not the only measurement of success if you're a community college student. There are so many other things that go into being successful, and if you can go out in the world and get a job after you've taken a course or gotten a certificate here, we've been successful. We had some interesting discussions regarding the America College Promise Act, which is a proposal that President Obama had. And I think all of us as trustees were on the same page with the legislators in that the community college attendance is really important, but a free community college for everyone is not necessarily the way to look at this. There are a lot of problems with it. It's going to have an impact on other federal programs. It could affect local control, which I'm sure none of our faculty wants. It also could cause mandates that we're going to end up with, like they did with No Child Left Behind, and obviously that's not going to help us. The big thing that we took away from there, and we stressed with legislators, and that Senator Durbin proposed, is that we want to start thinking K-14 for education, not just K-12. And we want to try and get everybody into that mindset where you're looking at high school is not the end. You still need more after high school if you're going to be successful in the community with a job. So with that, I'd like to invite anybody else to speak who wants to speak about what they took away from the legislative summit.
Yeah, I thought Congressman Gold was rather low-key and asked what we needed, what we prioritized, as opposed to maybe a stump speech that some others might provide in the past.
He seemed to be genuinely interested, and I know that he did come then a week later and visited CLC. So, you know, that was a benefit also. I think it's important to keep our legislators involved. Senator Roscom was not available. We met with one of his new legislative aides, but he only has a very small piece of our county also. So that really the biggest issues were to meet with Kirk and Durbin and Dole were our primary key people that we wanted to work with. Anybody else have anything to say?
Yeah, I think it's important, one of the reasons we're going there, besides the ones that Chairperson articulated, is in the amount of money that we actually get from the federal government, and NEC and Pell Grants and all the other grants that we get. We talked about the number. Do you want to just talk about the total number a little bit, maybe divide that up? Because this is a significant amount of money that we get from the federal government.
Sure. We told the legislators that our Pell Grants have basically tripled since 2009, and we're now at about $12 million. And then with all the grants and everything else we receive, we're about $40 million in federal funding.
$40 million visit.
Yeah, that's a lot of funds to keep. We don't want to lose any of them.
Nope, not any of them.
I know at on the staff level for ACCT, the Association of Community College Trustees, I had a lot of conversations about why the high priority on the American Promise, the 2 years of free tuition. And it wasn't so much that we were going to get the free tuition in a short period of time, but so much as to start the conversation that 2 years of community college work or 2 years of higher education work is the equivalency of what a high school diploma was 20, 30 years ago. And at least we can start the conversation how important it is for students to start thinking for not just graduating from high school, but graduating from high school and at least continuing 2 more years of higher education. So the way the policy initiatives were thought through and carried out at this session, I thought was very good. My part of it, of course, is the state meetings where I'm now chairing the Baccalaureate Study Committee for Community College Trustees. And we're having a big meeting in Naperville where we may or may not take a position on whether or not 4-year degree offerings at community colleges is a good thing. And I'd be interested if any other trustees here have any comments on that.
I mean, what did the president say? President's Council.
They voted unanimously with 1 abstention to support the idea. And it would be in BSN, Bachelor of Science in Nursing, and some other applied science curriculum where we start the experiment and start with the first few experimental programs. And the community college doesn't want to participate, they don't have to. So it leaves it to local control as to whether or not it's a good idea or not. So.
Why wouldn't we take a position?
Well, I was just going to say, if we want, and it does relate to this whole item we're talking about in general here, but it would probably be good if I think the administration heard from the board at least your initial thoughts on that. There'll be a lot more work going
Yes.
on it, but obviously if they're going into March, that meeting will be,
The 15th, I believe.
yeah, so it'll be before the next board meeting.
And there'll be a seminar before it on Friday afternoon. Hopefully some people from Florida, which was one of the pioneering states on this concept, will come and talk about how it's worked out in Florida and the successes they've had. And if Illinois does do this, we'd be the 22nd state. 21 already have this in place for community colleges. And of those 21, a couple of them are newer, so they don't have much of a track record. But of like 18, 19, 20 of them, everyone that's instituted it has gone forward with more program offerings, more degree offerings. Nobody's gone backwards, and that's an important point to remember.
So let me, if each of you maybe had some comments on that now, that might be good. We're not asking to take a stand, but if you had any thoughts, I will tell you this. I talked to the faculty senate about it. There was a lot of interest here. And then last week, I went to the University Center and talked to their CMI group, their council member institutions, about that. And, you know, I see this also, you know, as having, well, let me hear from you first before you get my feet, but I'd like to.
Yeah, I'm still struggling. Why would you think that the trustees would support it? I mean,
Well,
what gives you that reason?
we think they will, but I have read some news articles from other reports from other college boards that there's a feeling that there'll be a dilution of our mission, that our mission is the 2 years and community education and addressing community needs. But, you know, a lot of that comes from the four-year schools that say to community colleges, well, it's going to dilute your mission, and your mission, that isn't your mission, and all that. It's kind of amazing, because in all my years on a community college board, I've never heard a four-year school ever be concerned about the community college mission, ever. And now all of a sudden, because we might go into some of what they consider their turf, they're concerned about our mission.
Especially with the nursing, I'm sorry, go ahead.
No, I just to clarify, then what you're talking about is it's like a pilot program that the BSN would be the area of focus.
That and some applied sciences, maybe dental hygiene, or whatever a community college feels the biggest need to have in the sciences in a four-year program.
So it would be
Career
based,
programs.
yeah, just to clarify, it would be based on a identified local need. You might even expect that some industries or corporations would back that need to validate it. And also, there's some debate about this. I think this, Rich probably knows a little bit more about this, but there's also that issue of saying, well, if a university will step in and provide that exact degree at an affordable price, then the community colleges wouldn't do that. So of course, obviously, you have that issue of what's affordable.
When you look at it from College Lake County standpoint, we take nursing for an example. We graduate, about 100 nurses a year? 120. And, you know, let's say McHenry graduates 75 and Kishwaukee graduates 75. You know, we all have agreements with Northern Illinois University, but they're not going to be able to take all those nursing students for a junior and senior level work if all of them wanted to go and do it. So it's also capacity. And regardless of what we think, for years we fought the battle that 80 in nursing is the equivalency of a BSN degree, and that our nurses are just as good. Well, we finally got undercut by the Nursing Association by having these magnet status for these hospitals where 90% of the nurses have to be BSN degree nurses, and our nursing students are finding themselves on the outside looking in. So if there's not programs for them to complete, that's a big issue for our students.
Well, I don't think all our students are on the outside looking in, because I think a lot of our nursing students are students who have BS in public health and maybe another field and graduated somewhere else where they couldn't get nursing or didn't decide they wanted nursing at that
Right.
time. But yes, there's certainly been this national movement that they want degree nurses.
Right.
Anyway, I'm all in favor of it, so
Excellent.
that's my opinion.
Thank you.
Go ahead, and thanks for doing it.
Thank you.
Absolutely.
Great.
Well, healthcare is going to be one of the biggest growing fields as we
Yes.
continue going forward, and the baby boomers continue to age, and they're going to need more and more care, in-home healthcare, nursing care, whatever. It makes perfect sense.